Hi, my name is Becky Ruby. I'm the clinical educator for surgery.
And I'm Jackie Grabsky, the neurospecialist.
Today we're going to be talking about preparing a cranial bone flap for storage off-site. At times it is impossible to replace a patient's cranial bone flap due to increased cranial swelling after a cranial trauma or scheduled craniotomy. Providence Regional Medical Center Everett does not have the facilities to store a frozen cranial bone flap until it's time for reimplantation, which may be several weeks. Our sterile cranial flap preservation kits from California Transplant Services are kept in the OR 2B core on the wire rack outside OR 207. The sterile preservation kit contains 3 sterile green bags, 1 sterile Nalgene jar, 1 sterile marker, a label for the jar, a label for the patient record, and uncounted dressing sponges. The scrub person first obtains a culture from the graft, and in doing this, try to obtain tissue for the culture itself. Then the scrub person rinses the cranial bone flap with sterile saline. The cranial bone flap is wrapped in sterile gauze, which are the uncounted sponges with the kit, and this protects the bag from the sharp bone edges of the flap. The cranial bone flap is placed in the first sterile green bag. An antibiotic of the surgeon's choice is mixed in the HMEM solution that comes in the preservation kit. The cranial bone flap is covered with the provided HMEM tissue culture solution. For this demo, we will not open the solution. But if we did, we would cover but not overfill with the solution. Squeeze out any excess air and secure the first green sterile bag with a common knot. Any excess bag material may be cut off with sterile scissors. The bag is then placed in the second green sterile bag and tied again with a common knot. The double-bagged cranial bone flap is then placed into the sterile Nalgene jar provided. The lid is placed on the jar and tightened well. The scrub or circulator places the ID label on the outside of the Nalgene jar. The scrub or circulator places the Nalgene jar in the third bag and ties with a common knot. Styrofoam shipping box is completely filled with wet ice in Ziploc bags. The styrofoam box is placed in the plastic liner provided and then placed in the outer cardboard shipping box. The circulator completes the entire autographed tissue preservation service form with a ballpoint pen. The neurosurgeon must sign the bottom of the form. The autographed tissue preservation form, a copy of the patient's face sheet, and consent for surgery is placed in the clear plastic bag and placed on top of the styrofoam box before sealing. Leave the package at the OR control desk for pickup by the courier, which is arranged when you call California Transplant Services. If you need further information about the complex procedure for storage of a cranial bone flap for transport off-site, call Jackie Grabsky at 442-93 or Becky Ruby at 444-86.